As stated by the Honorable Prime Minister, apart from the health response and the economic response to COVID-19, there's also an aspect in relation to domestic violence. Disease outbreaks affect women and men differently, and pandemics make existing inequalities for women and girls and discrimination of vulnerable groups, such as persons living with disabilities, the elderly, children, and those in extreme poverty worse. And as stated by the Honorable Prime Minister, when households are placed under strain and as strategies for quarantine and lockdown are employed, the risk of gender-based violence tends to increase. Reports from other countries are confirming that COVID-19 is driving similar trends right now. In China, activists had reported a surge in domestic violence as millions of people had been under quarantine. In the United States, the National Domestic Violence Helpline reports that a growing number of callers say that their abusers are using COVID-19 as a means of further isolating them from their families. The scenario is reportedly the same in France, where reports of domestic violence has jumped more than 30% since the enforcement of lockdown. This trend has been further confirmed by the UN Special Procedures handle on Twitter this week. As we know, the spread of the COVID-19 cycle can be broken if we restrict movement, apart from the compulsory hygiene precautions we ought to take. Given the nature of the first confirmed case in Lautoka, a total lockdown of the city was necessary to stop the spread to other parts of Fiji. We are now also moving towards a curfew from 10 p.m. to 5 a.m. daily starting tomorrow. We have not received any information on hikes in such cases locally at present, yet we anticipate this to happen, given lessons from the past times of emergencies and crisis nationally and current global trends. The closure of schools further exacerbates the burden of unpaid care on women and girls who absorb the additional work of caring for children and loved ones. Despite the above, I'd like to stress that the safety, security, and economic protection of all women and children, including those with disabilities and marginalized groups, is a top priority for government. Through the Safety and Protection Cluster, the Ministry of Women, Children and Poverty Alleviation is working closely with the signatories to the National Service Delivery Protocol, such as the police, key government ministries, frontline service providers such as Fiji Women's Crisis Center, Medical Services Pacific, Empower Pacific, Salvation Army, and others to ensure that women and girls are protected and perpetrators do not use COVID-19 as an opportunity to commit violence against women and girls. I wish to inform all Fijians that our National Domestic Violence Helpline 1560 and the Child Helpline 1325 will continue to be fully operational 24 hours a day, 7 days a week during the periods of lockdown and curfews. These are toll-free lines. I ask you to take close note of these numbers again. Domestic Violence Helpline 1560, Child Helpline 1325. Save it on your phones. Share it with your children and those you're in close contact with. The Ministry of Women, Children and Poverty Alleviation will be working closely with other government agencies, CSO partners, and relevant stakeholders to ensure gender-responsive support to women as a priority and guarantee women's equal voice in deciding how best to tackle the virus. There will come a time when this pandemic will be behind us. Today, the responsibility is on all of us, government, the private sector, civil society, and individuals alike, to ensure that the response and support available meets the needs of both women and men. We must understand each other's concerns and vulnerabilities. This will limit not only the economic, but also the human cost to COVID-19. We will emerge from this crisis stronger together. Women and girls must not be left behind. They must be front and center in all response measures. It is up to us. It is up to you. Thank you. Do you have any questions?
Have you noted any spike in reports of domestic violence?
No.
Since this crisis began?
Not at the moment, not yet, but we're anticipating it.
And what sort of a boost to your services have you prepared in anticipation of that spike?
As mentioned, the helplines that are already available, it's already known out there. As media partners, it would be great if we could elevate the promotion of the helplines, the child helpline and the domestic violence helpline during this time.
What sort of services can survivors or women in these situations get if they call that helpline? Aside from
Depending on the circumstances that a caller presents, there are trained officials at the other end of the helpline. There's counseling services available. There's referral pathways to the various frontline responders, the police, for example, or shelters, depending on the circumstances. The first step to take is to make that call. Thank you.